While we are discussing the geriatric psychiatry or the problems that are related to the old age group, that is basically more than 65 years of age group that we're discussing right now, the problems that are quite prevalent over here are the organic disorders that can manifest themselves as psychiatric illnesses. For example, it can be the cognitive disorders, it can be the cognitive as well as the behavioral disorders as well. Basically, the etiology over here, it can be any organic cause that can relate to the psychiatric manifestations. Then we can come across the substance misuse in these old age group people as well. Now, the most common substance that is misused in this age group is the alcohol. So there are quite misconceptions out there that is relating to the alcohol use in the old age group. So we'll be discussing all of these misconceptions along with the risk factors that can make the person more prone to development of these substance misuse behaviors, as well as the treatment guidelines when a person is basically suffering from such kind of a substance misuse over here. So in this section, we'll be focusing on the organic disorders, which can manifest themselves as psychiatric illnesses. Now, the most notorious of these disorders are the delirium and the dementia over here. So we'll be discussing the definitions, the clinical manifestations, along with that, the management of a patient who is suffering from delirium or dementia. Then we'll have the discussion under thought over here is the substance misuse. As I've already mentioned, alcohol will be discussed over here, alcohol intoxication along with it, and then we'll be discussing the clinical manifestations of alcohol intoxication or the chronic alcoholics will be discussed over here. What are the preliminary investigations that are carried out in such chronic alcoholics will also be discussed along with the management guidelines over here in this section. So focusing on the organic disorders, first of all, it comprises of the psychiatric disorders that arise from the demonstrable abnormalities in the brain of an individual. So the brain structure and function over here is very important. Carrying out the preliminary investigations such as the CT and the MRI, that is the imaging techniques, is very important over here. The cognitive impairments, that is the most common feature that we come across, especially the dementia and delirium. Behavioral and cognitive impairments are most common over here as well, and maybe the sole manifestations of such organic diseases. So defining dementia, there are the multiple cognitive defects. Memory impairment is quite commonly seen in individuals who are suffering from dementia. Then we have the other cognitive disturbances. So the thought form, the thought content of the individual will be affected at most over here. Aphasia, agnosia, apraxia will be discussed over here. Then we'll come across the disturbances of the executive functions. So the primary motor functions, the major motor skills of the individual will also be affected over here. And then there will be a disturbed attention, perception, and orientation. So all of the thought forms, the thought contents will be disturbed over here. The attention, perception, as well as the orientation of the individual in the time and space will be affected over here of a person who is suffering from dementia, and can be due to multiple causes. So the associated disturbances of the other functions, we'll have the impaired emotional control. The person will be suffering from depression, anxiety, psychotic symptoms, and impairment of judgment as well. Associated neurological symptoms, it will include, usually the manifestation would be quite late in the disease. There'll be various sensory and motor manifestations along with them, incontinence, and the patient would be quite bedridden after the neurological manifestations of the disease. When we look at the brain in general, it's basically consisting of all of these parts. That is basically the frontal lobe, which is basically controlling the personality and the thought form, the thought content of the individual. Then we have the parietal lobe, we have the temporal lobe, which has basically the speech areas, the Broca's areas. All of these speech areas will be affected if this parietal lobe is affected. We have the occipital lobe, which is directly connected to the vision of the individual. Then the cerebellum, if affected, it is basically enhancing the balance or the walking, even the gait of the individual would be affected if the cerebellum is affected due to any organic cause. Then the brainstem, basically a lot of cranial nerve nuclei, they are located in the brainstem. So any damage to the brainstem would lead to subsequent manifestations. The substance misuse, if we just have a look at the most commonly used substance that can be used by the old age people as the drug of addiction, it is the alcohol. So the drinking levels, that is 1 in 5 men and 1 in 10 men, they have reached the harmful levels. During past 20 years, the rise in substance misuse has been observed. So it's quite an underrated problem that is usually seen in these individuals. The risk factors that are involved over here are the poor mobility or the pain. It is one of the risk factors that the person starts using alcohol and then starts misusing the substance. So the alcohol misuse, bereavement, illnesses, and then we have the social isolation or boredom. So all of these risk factors, they contribute towards the development of the substance misuse phenomena. So all of these risk factors, if they are not present in an individual, then he may not be more prone to the development of this alcohol intoxication phenomena. The clinical manifestations in such a case are the physical disorders. First of all, that is the infection, stomach problems, ulcers, anemia, and liver abnormalities. Then we have the falls, that can be fractures, reduced mobility, and subdural hematomas, problems with the drug interactions. That can be the effect of the certain drugs. For example, warfarin is reduced in the alcohol intoxication. Then the neurotoxic phenomena such as delirium and dementia is quite frequently observed in individuals suffering from alcohol intoxication. The screening tests that are usually performed in such individuals are the audit, safe, limit, and there are different questionnaires that are designed for such screening tests. That basically includes the audit, that is the Alcohol Use Disorders Identification Test. Then we have the SMAST-G, that is basically the Short Michigan Alcohol Screening Test that is specified for the geriatrics, that is the geriatric version is manifested over here. And then we have the CAGE, which is an abbreviation for Cut Down, Annoyed, Guilty Eye Opener Questionnaire. So all of these questionnaires are put forth for the old age people, and then we can just screen out the individuals who are substance misusing these drugs. The treatment involved, the patients are usually benefited from thiamine and vitamin deficiencies. Why is the thiamine and vitamin deficiencies covered? Due to the phenomena of the Wernicke's and the Korsakoff syndrome, which develops after the alcohol intoxication. Just to cover up this phenomena, we're going to treat these patients with thiamine for thiamine and vitamin deficiency along with it. The drug and the alcohol services are also sought into, and after the collaboration with these drug and the alcohol services, the patient is put in the rehabilitation centers for the revival. Now, the benzodiazepines are also used, but they have a side effect which is known as the automatism, so it should be looked for. So in this section, basically, we dealt with the organic disorders and then the substance misuse, which is quite prevalent in the geriatric age group. So that is the end of the section. Thank you for watching sqadia.com.